Anita, and I am currently a senior lecturer at ARU, and my background is mostly in children's nursing, although I qualified as an adult nurse originally and spent a few years in adult nursing in general medicine and infectious diseases. I then went to Great Ormond Street in '96 and did my child nursing and spent a few years in nephrology and worked overseas a little bit as well, did some voluntary work and worked in general paediatrics overseas. But I always wanted to be a community children's nurse from doing my placement as a student nurse. So after I felt that I had enough experience to bring to the role, I applied for a children's community nursing job in 2004 and I was delighted to get the job, and I went on and did my degree in community children's nursing, and I worked for the same trust and on the same team in the community for 11 years. So I really loved it. And then I left that to do diabetes nursing, to become a children's diabetes specialist nurse, which also involved a bit of community nursing and visiting children in their home as well. So I did that for about 7 years before I came to ARU. I think what I most enjoyed was the relationship that you develop with children and their carers, their parents, their families as a community children's nurse. Particularly for those with chronic conditions and complex conditions, because you tended to have that relationship for a long time, and you might be with some families from the child was born until they transition into adult services. I felt quite privileged to be able to care for children in their own homes. I liked the variety in the role. No 2 days were ever the same. I enjoyed the autonomy of being able to plan my day and plan my visits around the children that I was seeing and their needs. And I really enjoyed the team that I worked with, and we linked in really well with the hospital, with discharge planning, and obviously linked in well with other professionals in the community like the health visitors, school nurses, social workers. And I felt that we were a little bit more than community nurses. We were also very much had a role as advocate for families and did a bit of key working as well, which was really important for families. I think it's good for nurses who like to work autonomously and feel they can work autonomously and independently, but also as part of a team. Obviously you need to enjoy driving, because obviously some areas you're driving quite a lot from one visit to the other. I think it's nice to be able to plan your day around your visits, and you're not restricted by the same kind of structure that you are and routines of working in the hospital. And I think it's really good for kind of being able to kind of really focus on your family and your child without the distractions that you have in hospitals. Yeah, and I think the variety in the role is really good. So if you like to have a bit of variety and not maybe specialise in one particular area, then you do get that in general paediatrics in the community. And it's that kind of having that relationship with families and being able to be a key worker and link in with families and other people in the community. And that collaborative working. So if you enjoy that, I think it's a good role.